It's been one whole year of dealing with COVID-19, and today we'll talk to guests about where we are now, what's changed, and why we still need response from both healthcare professionals and government officials, as well as continued protocols. Welcome to Aging Insights. I'm your host, Melissa Chalker. Today I'm joined by Laurie Facciarossa Brewer, New Jersey's long-term care ombudsman, and she's going to talk to us about how her office has responded to the COVID-19 pandemic and what the outlook is now compared to when the pandemic first started in March of 2020. We're also going to provide you with some information about access to and availability of the COVID-19 vaccine, and speak with Charles Clarkson from the Senior Medicare Patrol about potential scams and fraud related to the vaccine. Great. So to review sort of where we are 1 year later with COVID-19, we're joined today by Laurie Facciarossa Brewer, New Jersey's long-term care ombudsman, and in particular to talk about the impact that this pandemic has had on the older adult population and on the work that you do there at the Ombudsman's office. So Laurie, before we jump into that, can you tell our audience a little bit about the Ombudsman's office and your role?
Sure. And thanks for the invitation to speak to you today, Melissa. The Office of the Long-Term Care Ombudsman is an advocacy organization, and we are located in but not of the Department of Treasury. So we are a state agency, and we advocate for residents of long-term care by investigating allegations of abuse, neglect, and exploitation. And in addition, we do a lot of systems advocacy and legislative advocacy with partners like yourself. We serve primarily the over 60 population in long-term care.
Right. And so I can only imagine that over the past year, your office has been inundated with calls and work to do related to the COVID-19 pandemic. Is that right?
It absolutely has. I mean, it has dramatically changed how we do our work in much the same way that it has dramatically changed all of our lives. As an advocacy organization, residents of long-term care are at the center of everything that we do, and their lives have been turned upside down, right? Because since the middle of March, visitation to long-term care has been severely restricted. And in many cases, residents of long-term care have been restricted to their rooms, with exceptions, for almost about 10 months. So yes, it has changed how we do our business for a good part of the last 10 months. Not only were visitors not allowed, but the ombudsman program wasn't allowed. I'm happy to say that we are back going out into facilities, doing our investigations and doing advocacy. But yes, the world has completely changed. In the beginning, it was families calling us and residents calling us and saying, where is the COVID? Is it in the facility? Nobody's telling us anything. And then people couldn't get through on the phone. Residents were calling and saying there wasn't enough staff because so many staff were getting sick or having to go into quarantine. So it really evolved over time, and everything we were doing was COVID related. I would say over the past summer or so, we've gotten back to some of the normal types of care complaints and abuse complaints that we normally handle. But of course, at this time of 2021, we are seeing an upswing in the COVID cases. I do think we're better positioned to deal with it, but it is still a major problem in long-term care.
Sure. So it sounds like there, as you've described, there has been such an evolution of the type of calls that your office got from March of 2020 until now, right? So a lot of those calls in the beginning where people were confused and didn't know what to expect and had a lot of calls about visitation. So now, as you say, you're getting more regular calls, but what's different about the COVID calls you're getting now versus those you got in March of 2020?
Right. We're not getting as many of the desperate calls that there's nobody here. That there's one CNA for 100 residents. We're getting quite as many of them, although I have to tell you that lack of staffing is a huge problem in long-term care and always had been. And the COVID-19 crisis has certainly laid bare how thin the ranks are there and how thin the margins are in terms of being able to provide coverage. But yeah, visitation really has remained a huge problem because during, I would say about October no, around August, the state created an essential caregiver designation and opened up compassionate care visits, right? But that's been applied really unevenly. A lot of long-term care facilities have been really great and have designated family members as essential caregivers, and they've even provided them with vaccines, and we can get to vaccines in a minute. But others have been really, really reluctant to allow any kind of family or caregiver visits. So we have had a role in trying to really push through from a systemic issue, the need for there to be essential caregivers, and also on a case-by-case basis, advocating for residents to have access to an essential caregiver.
Right. As you mentioned in the description of your role as ombudsman, that your office not only advocates personally for people who call with complaints or concerns, but also does advocacy on a systemic level. So is there anything you'd like to share with us about legislation that's happened in this time period to address COVID and other issues within long-term care that you'd like to mention or you'd like to highlight at this time?
Well, I have to say, I'm really proud to work in a state like New Jersey, whose governor and legislature and and various departments at the state county level have really leaned into reforming the long-term care system. I think that the COVID-19 crisis really illuminated a system that was failing in many ways already. And this is a long-term care system that is primarily publicly funded through Medicaid and through Medicare. It is clear that the infectious disease control practices were inadequate to the task of keeping COVID-19 out of long-term care facilities. It is certainly the case, and I will acknowledge this, that nobody anticipated what would happen with COVID-19 in terms of what the training needs would be in terms for staff, the amount of PPE that was needed, the testing that was needed. A lot of that was kind of missing at the beginning. But New Jersey has really leaned into figuring out what went wrong and fixing it. So the governor brought on board a national consultant who made recommendations about the types of reforms that are needed in the short term to deal with the COVID-19 crisis, and in the long term to shore up our long-term care system. And so there's a number of legislative victories that have been notched. Certainly, we have a direct care staffing ratio bill that has been introduced every year since I was in high school. No, that's a lie. Maybe every year for like the last 6 years, and finally got passed. And got signed by the governor. But other pieces of legislation that require long-term care facilities to have a program to address social isolation of residents. Additional funding for long-term care. There are pieces of legislation at various places in the process that require long-term care facilities to be enrolled in what's called like a special focus program if they have too many deficiencies, where the state of them will find them more and they will monitor them more closely if they have too many problems. I think that's important. It's welcome. Another thing that New Jersey is doing is they're looking to put in place basically a medical loss ratio in long-term care, direct care ratio, they're calling it, to make sure that the vast majority of the public funding that is going into long-term care is going to direct care workers and not into the profits of private providers. And so I think these are all things that the rest of the country is looking at New Jersey and saying, okay, you took this crisis and you're trying to develop some good policies as a result of it. So I'm really pleased about that. And certainly, the long-term care ombudsman program and our other partners have really pushed for that.
Yeah. Well, I just want to say thank you to you in your office for all of the work that you do on behalf of all older adults across New Jersey, but specifically those who are benefiting from the reforms in the long-term care community as well, and for joining us today to share all this great information. Before I let you go, I did want to ask you if there was anything you'd like to share or any information you'd like to pass along in regard to the vaccine, since you did mention it just a few minutes ago.
Well, I would say that obviously I urge everyone to get the vaccine. That is the strong message. I think the residents who have been in lockdown for months are agreeing in great numbers to have the vaccine. There are fewer staff than residents as a percentage who are agreeing to have the vaccine. I hope that that changes. I hope that more members of the staff in long-term care decide to get the vaccine, because that is really the only way that we're going to get back to normal. But I think just the larger issue, and I think I pointed to it earlier, is that we do have the ability to make change in long-term care. We have the ability to make these systems work better for the residents of long-term care. And I think that if nothing else, this horror of COVID-19 has shown a light on an industry that was struggling in some areas. Not that there aren't some absolutely wonderful providers and staff out there who have just done an amazing job, but I think that this is an opportunity, and I think we need to look at it that way. And I would just finally say, if anybody has any issues or concerns in long-term care, absolutely reach out to my office. We are always there for the residents and families.
Absolutely. And we'll make sure to provide that contact information on the screen for folks so that they can know how to reach you and get any information that they need or advocacy that your office so greatly does. So thank you again, Laurie, for taking the time to join us today. You've really been a wealth of knowledge for our audience.
Thanks so much, Melissa, and congratulations on the new name.
Thank you. Really appreciate your support with that as well.
And new website.
Yeah, that's great. Thank you so much.
Thanks.
As you know, the COVID-19 vaccine is now available. It was rolled out slowly, first to healthcare providers and first responders, and then to people most at risk. And now, as we see it continue to expand availability to other populations, it's important that you know where to get information. As we've already said, the best place for information is to visit the state's COVID-19 dedicated website, which is COVID-19, it's COVID-19, COVID-19.nj.gov. And there you can find out if you're eligible, you can register for the vaccine. There are several points where vaccines will be available at the mega sites that have been developed by the state, at hospitals, at pharmacies, at your doctor's office, at federally qualified health centers, urgent care centers, places like that where the vaccine will be available. If you don't have access to the internet or you're uncomfortable making an appointment online, you can call the Department of Health's hotline for assistance with getting an appointment, and that number is 1-855-568-0545. Again, 855-568-0545, where you can get information and assistance about getting an appointment to receive a vaccine. If you have questions or concerns about vaccines and how they work and the safety of them for yourself, please be sure to reach out to your own medical provider to ask those questions before making any actions. So as we've been saying, it is nearly 1 year later now that we've been dealing with the COVID-19 pandemic, and the vaccine is available, and we've provided you with information about that. But what happens when we have news like that is that potential scams pop up. And so here to talk to us a little bit more about that is Charles Clarkson from the Senior Medicare Patrol. Charles, thank you for taking the time to join us today. If you wouldn't mind reminding our audience, I know most of our viewers, if they've been around for a while, have seen you on previous episodes of the show, but if you just remind folks what the Senior Medicare Patrol is and what you do.
Okay, well, the Senior Medicare Patrol is a federally funded program. It's in every state plus a number of territories. There are 54 in total. And the mission is really quite simple, is to educate seniors about Medicare fraud, waste, and abuse so they don't become victims. And we do this by outreach, and at live events, which unfortunately we haven't been able to do since March, but eventually we'll get back here. We go to expos and fairs, and we do Zoom calls now, but basically our job is to educate, but we also help people and assist them with investigating Medicare frauds, and we will help them. We have volunteers, and we've done a pretty successful job in helping people with their issues with Medicare billing especially.
Yeah. So with that focus on education, that's why we wanted to have you here today, because we do know with everything that pops up, we've talked to you before about scams that had to do with new Medicare cards coming out or with open enrollment or various things. Even at the beginning of the COVID pandemic, you joined us to talk about how there were testing fraud scams and things that were popping up. So now we have the vaccine. What are you seeing? What are you hearing? What should people know about protecting themselves from scams related to the vaccine?
It's almost like a perfect storm. I was on a Zoom call yesterday, and the only thing these people can talk about is how they get registered, when they get registered, how they get the vaccine. So there's a lot of built up demand for this. So that's a perfect thing for fraudsters, because now what we're seeing and what we want people to understand is that, number one, don't listen to any emails, text, telephone calls offering you COVID-19 vaccines. No one is going to call you that's legitimate, that will offer these vaccines to you. The only thing you need to do is to sign up at a legitimate site. Now, I know there are some county health departments, and there's also the state of New Jersey, and I just wanted to give that website. So it's covidvaccine.nj.gov. And that is the official website for the state of New Jersey to register to get the vaccine. And really, because fake emails, they look legitimate. We've heard a story where someone, they asked for their Medicare cards, their checking account, their credit cards. These are scams, and so don't let your desire to get the vaccine so desperately let you fall into these traps. And that is really an issue.
Mm-hmm. Yeah, I think those are great points. And we've talked before about the things people should look for to make sure that an email or a phone call is coming from a legitimate party. And I think you've given great advice before, both here and in on our blog, which is to say, if you're not sure, hang up, right? Or don't respond to that email and call or visit directly the legitimate website for that service or provision. So that is also true with the vaccine. I know that, as you mentioned, the county offices on aging and the county departments of health, they might be doing specific outreach to make sure that they're getting to older adults, especially those who might be homebound and such. So what can we tell people in terms of making sure that that this outreach is legitimate? First, I think the issue might be, you already mentioned, not giving away your Medicare number or banking information. Is there a cost for the vaccine?
No, there is not a cost. There can be an administrative fee by the provider, but no one should have to pay for the vaccine. And if you are charged, and I just heard a complaint about a site that was charging like $95, we want you to report that to us, because then we could advise the Department of Health in the county and also the state, and of course alert Medicare and the Office of the Inspector General that people are charging. Remember, the government has bought the vaccine so it could disseminate it to everybody free of charge. So really, that's one thing. And there are a couple of other things that are really urgent. First of all, you can't pay to put your name on a list. That's a scam. You can't pay to get earlier access to the vaccine. That's a scam. No one is going to call you that's legitimate to offer you the vaccine. That's a scam.
That's all great advice. It's exactly what I wanted you to tell people, Charles, is what to look for a scam. So if people ask you to pay money to get on a list or to register, that's a clear red flag that this is a scam, right? And if they ask for any identifying information that you feel is not appropriate for you to have to give to register or receive the vaccine, you should call the Senior Medicare Patrol, you should call Medicare, you should call the Department of Health, call any authority you can to let them know.
Absolutely.
and to double check before you give out any information.
Right. One of the key factors is that people who are doing this legitimately on the phone or whatever, or email sites like the state, they're not going to ask for you for personal information. And one thing we've heard is that no one is going to go door to door and knock on your door. It's happening. People are offering, vaccines and or to register for a vaccine. Now they're offering, it's fake. There's no way they can give that to you at a door-to-door site. So you have to really, really be careful. It's like I said earlier, it's a perfect storm. People really, they feel like their lives are in danger, and they have to get this vaccine no matter what.
Right. Yeah, I do want people to be cautious, as you said, about things that seem illegitimate. So a door-to-door might seem illegitimate, but I do know that the Department of Health is really trying here in New Jersey to make sure that everyone who is eligible and who is at risk, high risk, gets the vaccine. So they might be deploying some mobile
Yeah,
units.
well, yeah, I was about
So
to say, I
yeah.
did hear that we
Mhm.
are,
Mhm.
they are going to be mobile units to go to places where people are unable, but
Mhm.
nursing homes are already
Mhm.
being vaccinated with, like the Walgreens and the Rite Aids and the CVSs. So that's well underway. So it's those sites are taken care of. Other places it can be difficult, but and it'll get. The problem is we also have a great demand, but not enough sites with the vaccine to be able to hand it out to everybody who could just show up. So you have to register. Don't just show up. And by the way, I heard of another interesting scam that fake vaccine sites popping up. Remember I talked to you about genetic testing sites popping up? Now it's free, sign free vaccine, just pull up, give us your Medicare number, and you're golden.
Yeah. So I think we can't tell people enough to be cautious and to make sure, do everything that you can to make sure that the site that you're receiving the vaccine at is legitimate. Ask for verification, ask for proof, ask all the right questions, and most importantly, register at the state site for the most, guarantee that you're in the right place and that you're going to get the vaccine the right way. Charles, thank you for sharing all of this great information with everyone. If people are interested in educational programs by the Senior Medicare Patrol, how can they get in touch with you?
Well, you could call us, which is the easiest way, at 732-777-1940. If you want more information about us, go to our website, which is www.seniormedicarepatrolnj.org, all small letters, except to the last two parts, no period. Senior Medicare Patrol NJ.org.
.org. Wonderful. I've been on the website. There's a lot of great information. Charles has written a lot of great pieces that are there to educate you. But if you'd like more education or more information, please do visit the website or give Charles a call. Much like he's doing right now on Zoom with us, he could do this for your group if you'd like education or information about
And
the
I
program.
have some good jokes.
Yeah, yeah, great jokes. So make sure, get him for the education, but stick around for the jokes. Thanks again, Charles. This has been super helpful for our audience, and I want them to be sure that if they are interested in getting the vaccine and are eligible for it, that they receive it without being scammed. So thank you.
Thank you for having me. I really appreciate it.
Thank you for watching this episode of Aging Insights. For more information and to view previous episodes, please visit our new website, www.njaaw.org, and click on the Aging Insights page. We hope that you enjoyed this episode and that you feel more up to date on COVID-19 1 year later and accessing the vaccine. Remember, for the most updated information, please visit the state's website, which is COVID-19, that's covid19.nj.gov, and there you'll find the most recent information from the state government about COVID-19 and the vaccine. We'd like to remind you that if you want to find out about information and services in your area, contact your county offices on aging. Their numbers can also be found on our website, or you can call the state hotline, which is 1-877-222-3737. Be sure to wear your mask, wash your hands, stay a safe 6-foot physical distance from others, but remain socially connected. Thanks again for watching this episode, and be sure to tune in next time.